this was a major crisis. This was the biggest health security event in a century, and arguably the biggest global challenge since the Second World War.
Hello and welcome to Clinical Changemakers, the podcast that explores vital lessons in healthcare leadership, innovation, and so much more. I'm your host, Dr. Jono. Today on the show we have Sir Ashley Bloomfield. He is a trained public health doctor and former Director General of Health for New Zealand. Sir Ashley Bloomfield is an advisor to the World Health Organization on pandemic preparedness. He is also a professor at the University of Auckland in the School of Population Health, where he will lead their new Public Policy Impact Institute. Sir Ashley Bloomfield, welcome to the podcast.
Kia ora. It's nice to be here, Jono.
Now, I'm really excited to discuss with you your leadership reflections on being at the centre of New Zealand's world-renowned COVID-19 response. But before we do that, I'd love to touch on your background, how your upbringing impacted your career, and how you found your way into medicine.
Yeah, thanks, Jono. Well, I don't come from a family of doctors. In fact, I don't even come from a family of tertiary students. So my brother and I were the first in our family, really wider family, to go to university. I come from a pretty modest background. I grew up in a very, in a sense, quite a poor suburb in Napier for the first 6 years of my life, and then shifted to Wellington. My father was someone who had left school quite young, as you did in those days, but clearly had capability and ambition, and he worked very hard, so he found his way into senior roles in the motor vehicle industry during his life. And my mother was a school teacher, and a primary school teacher, and I guess she was someone who really knew the value of education, and that I guess both of them had a huge influence on my life. I'm the middle of three siblings, and still, in very close contact with, and have a great relationship with my siblings, even though our parents are now passed. But I would say I come from a pretty modest background, but my parents saved very hard to send me to what they felt was the best school they could afford to send me to. And I, have always been one of those people who looks at the various opportunities and takes them. And for my part, that wasn't just academic, but I was involved in kind of just about every school pursuit on offering, including pipe band and athletic sort of pursuits, and of course, being a Kiwi, rugby as well.
And how do you feel that a generalist type of approach has impacted your career and leadership style?
Yes, well, one of the things I've done throughout my career is I have never had a sort of a 5-year plan about where I wanted to be. I've always wanted to keep, in moving through roles, but a key principle for me was to take opportunities as they arose, and indeed to particularly take those ones that might push me outside of my comfort zone, because that's where you learn, and particularly in leadership. Leadership's been described as like wading into the swamp. So you never get up every day, actually, and think this is going to be an easy day. It's always challenging. But the question is just how you respond to those challenges. And of course, the bigger the challenge, the greater the lessons, the greater the opportunity to grow, and the greater for self-reflection and insight. And to me, that's what's most important for growing as a leader.
Speaking of challenges, getting into medical school and then practicing as a junior doctor can be quite a challenge. What were some of the things that you learned most when you reflect on those earlier parts of your education and career?
It certainly can be a challenge, and I dare say that it was probably 30 years ago or more that I was a junior doctor, and I think it's even more stressful and challenging for those who are graduating now and heading out into an even more complex healthcare system. But one of the things I will say as a junior doctor back in my day, which was the early 90s, was you didn't have the level of more senior support. We were my wife and I were house officers or junior doctors in a provincial hospital here in New Zealand. And, I can well remember my first week where I was on the night shift and I was the only doctor in the hospital. And it was a very daunting prospect. 2 lessons from that. The first is that it's not just about you. You're surrounded by all these other good people, and in particular nursing staff who are hugely experienced and are there to support and advise and in fact even and teach you. So very quickly you learn that just because you're the doctor, you're not the one, you're not the smartest person in the room. But the second, of course, is that you realize that you've got the training, you've got the skills, and it's just a matter of doing one thing after another. So really, there's a cricketing analogy, which is keep playing a straight bat. And I guess both those things were fundamental to how I played the role when COVID came along. 30 years down the track in my career while I was Director General of Health.
With those earlier experiences in medicine, what was your exposure to leadership like, and what did you think about in terms of what leadership really was?
Well, I think we all, as we go through our careers and indeed as we go through life, we watch other people. And I love watching other people, and I love watching people in leadership roles, even now, to see how they deal with situations, to see how they respond, to see how they deploy different leadership styles. And I guess we all start to form a view about what we feel are good leadership responses and not so good leadership responses. And so I've always been interested in that, and particularly as you do medicine and you start to you work with key mentors, people who really guide you as you do your different attachments and different specialties. You get inspired by different people, and I certainly found that myself. And early on also, even as I was a junior doctor up in Whangarei here in the northern part of New Zealand, watching those who were in leadership roles inside the organisation. I was a union representative for the junior doctors there, and so I had interaction with them around some of the negotiations for junior doctors' pay and conditions, and just it gives you an opportunity. And I took that opportunity early on to watch how different people behave in those situations, because leadership really is ultimately about behaviours, and unless you're leading yourself, you're not really in a great position to lead others and lead context. And leading self, of course, is always about how you want to come across. What are your values? What are your behaviours?
So it sounds like a lot of this was getting at least framed up in your mind quite early on in your career. When you started to think about going into the field of public health, why were you sort of seeking that out, and what does public health mean to you now?
Well, public health as a specialty, for me, provided an opportunity to step aside from the clinical interface, which I really enjoyed. I loved the clinical work I did, both in hospital-based specialties and also in general practice. I did some general practice work. Public health, to me, provided an opportunity to kind of lift up and to look at health and well-being at a different level. And I really, in a way, went on with the training program because a good friend from medical school had done it. And he said, look, I think you'd really enjoy this. So I put my hat in the ring. I got selected on the training program. And I wasn't sure, but once I got involved, I realized, yeah, this is my place. This really pushes my barrow, as it were. And I again just took the opportunities right through my training to look at how could I develop a wide range of skills and experiences. So again, sort of taking that generalist approach. And towards the end of that training time, had the good fortune of spending some time in Wellington, in the capital city, as part of the policy ministry, and found that being part of the public service combined with public health was really my happy place. And I sort of joke about the fact I came to Wellington for 6 months in 1997 and I'm still here because I just, that nexus of public service, public policy, and the politics that goes around that, and the ability to really influence aspects of government policy at a level that would truly impact on wider population health and wellbeing was just, I found that exciting and still do.
Could you elaborate a little bit further on the influence side of things? Of course, you in your training you get to understand, the research and application in some areas, but when it does intersect with politics, there can be lots of other incentives that groups have and reasonable rationale for certain decisions, financial constraints, etc. So, what does it really mean to intersect with politics and influence politics?
Yeah, this is a key sort of currency for working in the public service. And one of the things about the New Zealand public service is it is politically neutral. So senior people, in fact, people right throughout the system, don't change when the government changes, when there's a shift in political persuasion from perhaps the left to the right or vice versa. I think it's a real strength of the New Zealand system. It's not the only approach, but it's the one that works here, and therefore fundamental to that is you have to be seen to be politically neutral. You have to be seen to be trusted, and to be able to have that stewardship role that endures beyond just the current government. So you've got that longer term view. And of course, influence in any setting is fundamentally about the quality of the relationships you have and relationships of trust. Even if you disagree on issues or approaches per se, the relationship of trust should endure beyond disagreements. You should be able to disagree agreeably. And so, some great advice I had early in my career was to spend a lot of time focusing on making sure the relationship is strong and enduring, regardless of what the issue of the day might be. And that's something, again, that served me very well through my career. And come COVID and the experience I had as Director General of Health, the 25 years of sort of investment in relationships right across the system, both the health system, I should say, and the public service system, really were fundamental, I think, to my ability to influence and to get things done.
And so I get a sense that, a strong public service is to you perhaps a pillar of a well-functioning democracy and society. I wondered if you could touch on, where that perspective has come from and maybe elaborate a little bit on how that belief came to be.
Well, a couple of things there. First of all, of course, was being in the middle of it and working in it and seeing and observing and learning from and being mentored by great public servants. And I guess that whetted my appetite and seeing the role of the public service in supporting good decisions to be made by governments that really did improve well-being and also address inequity. So that was a key focus for me. So sort of being part of that and I guess having been part of a group of people who were able to influence, and my early interests were around tobacco control, non-communicable disease prevention and control, and in some areas we did well here in New Zealand, and smoking was one of them. I guess the second real influence for me was spending time at the World Health Organization. I had a year in Geneva at the WHO, which was a really interesting, challenging, but informative year. And of course, once you step outside of your own experience, your own country, your own public service, and are able to look more globally and see how the public service functions in other countries or doesn't, and really then what are the prerequisites for good governance in a country that then leads to improvements in well-being and addressing inequities. And the things that struck me were, well, first and foremost, you need security, you need safety, you need there to be no armed conflict underway. It's very hard to govern a country and look after people if there's armed conflict, or if people don't feel safe, or security is compromised. But then, of course, those key elements of good governance that include a really strong, non-corrupt public service. And it wasn't until I stepped outside of the New Zealand public service and realised there were some things I had taken for granted. It's by no means perfect, but it's certainly seen as one of the least corrupt, most transparent public services globally. And so when I returned from Geneva in 2012, I had this renewed respect for, appreciation for, and commitment to the public service in New Zealand.
Yeah, it's always helpful to get some additional perspectives. And as you've commented, being a generalist and seeking out new challenging opportunities helps you to reflect on the current opportunities, back home or at the institution that you're working in. I wonder, when you reflect on the success of the trust and effectiveness of the public service, what are some of the key elements that New Zealand has going for it?
Well, a history of strong governance, and I think New Zealand has got the pillars of a strong democracy there. It's got pretty high voter and citizen engagement with election processes. It's got a strong, credible, highly trusted public service, and we saw that trust increase through COVID quite significantly when people saw, gosh, the public service is there, they've got our backs. we've got despite all the challenges that the mainstream media face with developments over the last couple of decades, we've got really good journalists here who take their job of holding those in power to account very seriously. And I was certainly on the receiving end of some of the pretty sharp questioning, and often on a daily basis from them in that regard. We've got an independent and strong judiciary, and we've got strong civil society as well. And so I think all those elements are essential if overall the country is going to be able to find its way, and in particular find its way through those events like black swan events like a global pandemic. We've got rapid onset of collective global amnesia at the moment, but this was a major crisis. This was the biggest health security event in a century, and arguably the biggest global challenge since the Second World War. And so it required a really thoughtful, strong, well-led response. And I guess all those elements combined in New Zealand to at least put us in the position where we could do that. They were necessary, but not sufficient. And then, of course, there's that secret ingredient of really strong, trustworthy, humble leadership that built the public trust that was required to get people to do quite extraordinary things that were necessary for us, particularly in those first couple of years of the pandemic.
That global amnesia point, I think, is a really good one. That we say the word pandemic without even flinching now, and that is a globally destabilizing, history-changing event, and has caused countless amounts of suffering. I just wanted to touch on what's kind of next, what's maybe missing, or what are the areas that we could be improving on, perhaps, such that we can keep building and growing that trust?
Well, a key thing for me is, and we saw during COVID, the imperative to act quickly, to implement rapidly, and not necessarily perfectly, but to learn and adjust and do things differently. And one of the challenges that politicians face, and indeed that governments face, is in normal times pretty low tolerance for risk. And so often that's reflected, and we might have very good policy that's evidence-based, there might be funding there, but where we tend to fall down or not necessarily achieve what we want to achieve is in the implementation. And what we saw through COVID was it was necessary to take risks. And whilst the media would often beat us up about failure, my pushback to them was actually it would only be a failure if we didn't review and learn and adjust. But in non-COVID times, we've seen, and it's not unique to New Zealand, this quite rapid reversion to the same old way of doing things, where decisions are made very slowly. There's often, not much sense of imperative of getting on and doing stuff. Things happen slowly, and then as soon as things don't go perfectly, there's sort of this major the brakes go on because of risk aversion. And I think that was a huge lesson from COVID, is we should be able to speak to manage and speak to risk, to manage and speak to problems when they arise openly and honestly, and actually recognize this doesn't undermine trust, it builds trust if we've got a really good explanation. But so in a sense, a little more impatience about the way we implement, the speed with which we implement, and the learning that we accrue as we go along, so that actually it's not going to be a perfect 3-year implementation by the plan that was set out on day one. It's that old military adage: your plan's fantastic until the first contact. So you've got to have the space and the approach that is allowing learning as you go and adjustment. And I think that the real challenge, especially with these wicked problems that we're still facing, is to be able to open up a space where we can implement rapidly and adjust as we go.
Yeah, and I think COVID was interesting because in some sense it was a very clear problem. While it was, as you say, a wicked problem with all sorts of incomplete, contradictory, changing issues related to this tricky virus, it also gave us quite a focal point that we could mobilize resources, people could understand the why, and we could move in that direction somewhat imperfectly at times, but at least we had a shared goal. How do you feel about healthcare in kind of non-war times, trying to get that same sort of alignment towards those types of slightly broader sets of goals?
Yes, just to emphasise the point you've made, that COVID created a really clear sense, not just of purpose of the why, but also of focus. And so we had to absolutely focus all our effort, all our resources on our response to COVID, and then of course part of that was implementing our vaccination program. So we showed how you can implement in New Zealand, and many countries did this. You can scale up and roll out an amazing population-wide and equitable vaccination program, which is not what we tend to do, as you say, in peacetime. The challenge for the healthcare system in New Zealand, and it is a challenge globally, of course, is it's got more, not less complex. Delivering health and healthcare has. The global context within which we're trying to do that has got more complex and challenging as well. And 30 years ago, perhaps when I was a junior doctor, the sense of purpose, the sense of focus was much easier to maintain. Whereas now with this increased complexity, it's really imperative that people do have that clear sense of focus and purpose. And I think we were already challenged in that regard pre-COVID, but then COVID's come along and sort of been a major disruptor in many respects as well. It's amplified and in fact kind of it's amplified some of those things that were already happening. I mean, health workforce is a really good example here, and the challenges we've got in New Zealand again are very much global ones. But what it requires, of course, is we can't keep muddling through. We need to really step back and say, and ask the question and look to answer the questions: what is the future of healthcare in a world where our population has aged, and continues to age, where there is much more we can do, where it doesn't matter how many people we train, there will always be a gap in the workforce. What's what are the things we need to think about and do differently? What's the huge potential for using data and digital tools for capitalizing on AI where appropriate? And most of all, and this is the thing I'm really interested in, is what I think COVID showed us is our biggest health workforce is our citizens. And we forget that most healthcare is provided by individuals and their families outside of formal healthcare settings, day in, day out, throughout their lives. And we need to think much more about how the healthcare system can train people to support our largest health workforce. And in fact, we relied on them as our largest health workforce during COVID to do the right things. And that was, in New Zealand, our success, that people took on that role. And I think there's a real lesson for us, and this needs to be, I feel, a lens that we need to look now at healthcare and think, what's the future of healthcare, where we fully enable citizens and as our largest health and healthcare workforce and wellbeing workforce to be best supported.
I really like this reimagining of the potential of healthcare, and that getting the power back to people who actually are the most invested in their well-being, as well as their family and the communities too. But it's also going to ask a hard question of health professionals, of how we embrace this, how we actually let go of some of the classical power, I think, that we've had for a long time. And I wondered what you thought about how we can better support this reimagination.
Yes, this is the key challenge, and in a way, it's one that's been recognised before, and it's been reflected in this notion of person-centred healthcare or family-centred. The rhetoric is there. the policy intent is there. Just as there is a policy intent around a much greater focus on primary and community-based service delivery, but there are these things that, and a colleague at the University of Auckland, Tim Tenbinsel, describes them as the kind of the black holes of in healthcare that have this gravitational pull. There's a gravitational pull from primary care to specialist care. The funding, the people tend to go in that direction, and even in the community, there's this gravitational pull from non-medical to medical delivery of care. So yes, it requires a sort of look at models of care and the way the health system is funded and the policy settings, but it also goes to the way we train health professionals. And you talked about power, and there's a phrase I really love, which is the only appropriate use of power is to empower others. And in a way, this is what we need to train our students and our health professionals in, is that it's not about them, their profession, or their organisation even. It's about the role that they play in empowering individuals. And this again goes to that relationship of trust that we saw was so important for New Zealand's response during COVID-19. Very often in healthcare, and particularly in public health, we're wanting people to change the way they do things, to change their behaviours, or to take on new behaviours. But we don't take the time to establish the relationship of trust for them to be sure that they understand the why. And in a way, this is that we put the onus on them, and we talk about health literacy. And if only people were more literate and understood health better. Whereas actually the responsibility should be on those working in the system. I've used this phrase, health system literacy. We need to understand the realities of people's lives, the issues that they're facing, the challenges they're facing, the things that motivate them, to get to the relationship of trust. And then, as we saw during COVID-19, if there is that relationship of trust, people actually will do quite extraordinary things. They know what to do and how to do it. And so that needs to go to the heart, I think, of the way we train our professionals for the future system.
Now, I wanted to just go back to the beginning of the COVID pandemic, sort of late 2019, early 2020, because we spoke a little bit about how good decision-making was essential. Planning and preparation is one part of it. And if you look at the pandemic preparedness rankings from 2019, the UK and the US were, I think, first and second or around that, and New Zealand was 35th. So there is planning does have a place, but taking action is also really important as well. How did you make sure that you had the structures and the processes set up such that you could make the best decisions you could in quite an ambiguous and time-critical environment?
Well, I dare say we didn't necessarily have those structures and processes in place. We had them to some extent because, like I imagine most or just about every country, we had security. We had appropriate apparatus to look at security threats, to do that initial response. But there's a big difference between a pandemic like COVID-19, where the threat is evolving and changing all the time, and is a sort of medium to long term situation, as opposed to a one-off event, which we'd had plenty of experience in New Zealand with earthquakes, with weather events. We'd had a terrorist attack in 2019 in Christchurch here. We'd even had a measles outbreak, but a measles outbreak in a sense is a known quantity. We know what to do. We had vaccines, and we were able to get on top of that reasonably quickly. The situation here, of course, was very different. And as you've pointed out, many countries had plans in place, and we were by no means unique in having a very thorough pandemic influenza plan. The problem was that the virus didn't play ball here, and we ended up with a coronavirus pandemic. So this then goes to the heart, and I think this is one of the key lessons for New Zealand and other countries, is that it's one thing to have the plans and preparation in place, and that is important. But the key thing is what happens once a threat like this emerges, and that goes, in my mind, very much to the leadership, the decision making, and the ability to have people who are trained to be agile and flexible and comfortable with advising on and making decisions with incomplete information in a rapidly changing environment. And I think that's where in New Zealand we might have been 35th on the Global Security Index. As you say, the USA and UK were first and second respectively. But we did have all those fundamental pillars to enable rapid decision making, and I think people who stood up in those leadership roles. And despite the huge challenge, the uncertainty, the stress, the intensity, and the relentless pace, worked collectively to make the best possible decisions in a timely way.
Now, of course, there were probably countless really challenging decisions that you had to make over the period, but certain decisions would have had, orders of magnitude that, you knew the next day or whenever it was going to be announced was going to be quite a big deal. What was it like for example, around the vaccine mandates, having those types of discussions behind closed doors, coming up with the options and plans, and then communicating that?
Yes, there were some decisions that were, in retrospect and even at the time, were so big that you hadn't anticipated you would be advising on those decisions, and that politicians you're working with were making decisions on things like national lockdowns, on closing the border, and requiring everybody who came into the country to spend 14 days in a managed isolation or quarantine facility, rolling out a vaccination program and putting in place mandates around certain groups being required to be vaccinated if they were to continue in their work, mask mandates, and so on. Of course, the important thing here is to make sure you've really canvassed all the advice you can, both technical and in particular legal advice. And New Zealand's got quite a high bar from a legal perspective. We've got a Bill of Rights, and so every one of those mandates, every decision that required people to do things did need to meet the requirements of the Bill of Rights. And so there was, many other countries don't have such a bill. And so in a sense, that gave a level of comfort that the legal advice we were getting from the government's lawyers was that under the circumstances, this was a reasonable and legally appropriate thing to do. I think the other key point here is we were constantly looking at and learning from what other countries were doing. And when it came to things like vaccination mandates, we were by no means unique. We were by no means the first. And whilst people might argue just because others are doing it, it doesn't make it right. Again, the context was this incredibly threatening global pandemic. And there was no doubt, and everybody, I think, took this seriously, that vaccination was a key way for us to find our way to a pathway out of all those restrictions, including border closures that were in place.
Yeah, and there were historical contexts for some countries around vaccine mandates as well, things like smallpox, I think, in the US. And I think when you look at the outcome for a lot of countries, if New Zealand had about 1,300 or 1,400 deaths, and if we were more like the UK, we would have about 13,000 or 14,000, and the US, I think, around 15,000 too. So there were the benefits of a lot of these really difficult, challenging decisions getting made in a timely manner, and the New Zealand public really fronting up and doing it for each other. I think that was quite inspiring. When you look at some of the polling after many of these decisions, there was quite a positive sentiment with these sorts of decisions being made because the why was really clear. And some of that why was your communication, standing up every day at 1 p.m. to speak to the country. Tell me, what was that like?
Well, I describe it as harrowing, and this was my big challenge really right through the COVID response was it wasn't intended, it wasn't by design, but from quite early on, the role that I played in regularly updating the public and often alongside politicians. Again, this wasn't a model that was unique to New Zealand. You can look at many countries had this combination of a sort of a public official with technical expertise and a politician, often the head of state, briefing the public on a daily basis. I guess the key thing for me was it became apparent really early on, and I'm glad from day one. When I stood up, I just was myself and tried to be calm and reassuring and come across as I think people would describe I would come across whether it wasn't a pandemic. When it wasn't a pandemic, the thing people most remember is the fact that I was calm, that I gave them a sense of assurance, even if inside myself I didn't necessarily feel calm. And this is an important thing. Again, it's that old leadership adage: people don't remember what you said or did, they do remember how you made them feel. Now, of course, it's one thing to come across as calm and assuring, but you've also got to be on top of your game. You have to have the information at your fingertips. You've got to be prepared to take on any question the media throws at you, and they certainly do. That's their job, is to hold us to account. And so there was 2 or 3 hours of preparation every day for those stand-ups, and they were a sort of a pretty exhausting experience. But as you've said, became fundamental to building the trust and confidence of the public, so that when we had to, when there were big decisions and we were asking quite extraordinary things of them, to go home and isolate at home for weeks on end, cut off from their connections to family and friends and communities, that they did it. You can't police a lockdown. Even we talked about the vaccine mandates. In fact, by the time the mandates came in New Zealand, we already had very high rates of coverage because people believed and they trusted the vaccination program, the vaccine, and the people running it. So, one of the conclusions I've drawn from COVID, and I've talked about this publicly, is that in a sense our communications approach was our most important public health intervention.
Yeah, and I think having that transparency around decisions, how they evolve, I think sometimes it can be easy to hold things tighter to your chest, but actually the public is very discerning, and I think people know if things are getting held back, and so I agree with you that that transparency is a powerful way to build trust. Now, with all the preparation for these media stand-ups, obviously you needed to have a great team around you, and that you need to lead that team such that you can get a lot out of them. You've got this saying that leadership is an invitation for collective action. I wondered if you could unpack that.
Yeah, thanks, Jono. I do think that's a great leadership definition. I've come across many in my career, and this one was actually just offered at a conference I was at about 5 years ago, a disability advocate here in Aotearoa, New Zealand. And the reason it resonated with me is, I guess it sort of rounded out what I had seen and what I'd learned in my career and leadership roles. First of all, it's not about, leaders don't tell people what to do. They ensure there is direction and a sense of purpose. So in a way, it's extending an invitation to people. Here's what we need to do. And it's a collective process and a process of engagement. Again, that the collective bit of this reinforces that leadership is not an individual pursuit. It's a team activity, and leaders go nowhere if they're on their own. And finally, this notion it's about action. I mentioned earlier on this analogy of wading into the swamp. Well, the thing about wading into the swamp of leadership is if you stand still, you sink. And so it's always about the next thing. It's about, going forward. It's about what's the next thing we need to do. Leaders never stay. There's no such thing as leading business as usual, the status quo. And so I think the definition just summarizes those core elements of leadership, and I've extended it to the offer of that definition to many people, and it seems to resonate. It's certainly one that guided me right through the pandemic. And as you pointed out, that people know, I knew, and the public in New Zealand know that it wasn't just me, the person standing up on the podium communicating every day, but there was this extraordinary team alongside me. And each one of those team members was absolutely essential to our overall effort and to my ability to be able to stand up there every day and confidently and calmly update people on what was happening, what we expected. and people tolerated a high level of uncertainty. Often our horizon was only 24 hours, but to know that we were doing our very best, that there was a team of people who were working night and day to make sure they were looked after, that New Zealanders were looked after, I think was again critical to building that trust, and therefore our ability to extend the invitation to collective action, which we had to do on many occasions, whether it was to stay home because of a lockdown or indeed to go and be vaccinated.
From stand-ups to then stepping down, how did you know it was the right time? And this kind of dovetails into thinking about pipelines of leadership and succession. How do we then build this capacity and capability within our organization such that, when someone like yourself stands down, we've got a whole line of people all ready to go? Because healthcare usually doesn't run with extra capability just sitting on the shelf. Everybody is working as hard as they can, and often it's just moving some people around.
And two comments here. First of all is, my decision to step down from the role 4 years in was a number of factors, but it was really, I think this is a really important leadership behavior, is knowing that the role's not about you, and that when it's the right time, it's important to step down. And I felt like I had given it everything. I had certainly had a pretty intense, extremely demanding time during COVID, both personally and also for my family. And I felt that, combined with the forthcoming quite significant changes to the health system in New Zealand, it was a good time for me to step back and allow others to step in and up and lead. And I had and have great confidence in those who have taken on those leadership roles in the system. So, good leadership is about knowing when to stand down. And then the second part, is of your question, is a really important point about a key role for leaders is to nurture and grow and success others, and ensure there are others who can step into those roles. And there are a whole lot of ways you can do that, but I just think this is a really important leadership behaviour of leaders who lead with humility. That those characteristics of leading with humility is as listening to others, knowing it's not all about you. You don't have all the answers. Being prepared to say when you've changed your mind or when you got it wrong, but also knowing that the role, that part of your stewardship responsibility to the role and to the system is to bring through and train and share knowledge with and coach and empower others to be able to step up into those senior roles as well.
What advice would you give future healthcare leaders who are looking to perhaps join the public service and get into leadership roles?
Well, the first advice I would give is that it's extremely rewarding and enjoyable, and there's no aspect of my public service career to date that I have regrets about. It's a great honour and privilege, and whilst COVID itself was a huge challenge, there was also, I guess, I firmly believe, an enormous privilege to be in the role I was in, to serve the public in that situation. The second piece of advice I would give would be to perhaps do as I did, take opportunities as they arise. The leadership's a learning journey, and every opportunity you have, whether it's a work or a non-work related opportunity, to understand more about yourself and to understand more about others, that's the way you will develop leadership skills, experience, and expertise. And I just encourage people to take those steps on that journey, knowing that it's quite normal to feel a bit overwhelmed, to feel a bit of imposter syndrome. I still do, and also to have knockbacks, that things won't go right. But those, in a sense, are a bit of a gift, because that's an opportunity to learn and grow. And to lead self even better.
Well, that's a perfect note to finish on. Sir Ashley Bloomfield, thank you so much for your time today. Thank you for all the work that you've been doing on COVID. And I know you're continuing to work hard at the WHO and at Auckland University. So just wanted to say a big thank you for all of your service.
Thanks very much, Jono. It's been a real privilege. Kia ora.
And that brings us to the end of the podcast. If you want to go deeper about any of these topics or join the discussion, visit our website, clinicalchangemakers.com. Now, one small ask. This is a brand new podcast. So if you enjoyed our work, please rate us and share it with your friends and colleagues. Until next time, take care.